We're here at the Health Innovation Conference 2025 at the Venetian in Las Vegas, talking to all sorts of leaders about the future of healthcare and health technology. Well, I'm joined now by one of those leaders, Joe Murad. He's the president and CEO of Vida Health. Joe, welcome.
Thank you. Appreciate it.
Great to speak with you here at the conference. And I want to learn more about how Vida Health is shaping the future of healthcare.
Well, Vida Health's mission is really to focus on not just preventing, but treating and eradicating cardiometabolic disease purposely through a personalized, evidence-based approach to distributing access to certain virtual care across a ecosystem of large self-funded employers as well as health plans for the purpose of lowering costs and improving outcomes.
What differentiates Vida Health in the space?
So one thing we do really well is we manage the entire population. So we don't just chase the high cost claimants. We focus on everyone from the low acuity preventative care opportunities to those individuals who require real care management and prescription drug management as well.
And why is personalization so central to the mission of Vida?
Well, obesity is an interesting category in of itself as a disease. And you have individuals who need to be treated differently. And we're all completely differently made up in a metabolic form. And we have different theories in which we believe we can treat those outcomes to have the best impact on those members.
We know that healthcare costs are rising significantly. They have been outpacing inflation, and prescription costs do have something to do with that. How is Vida working to manage those rising costs?
So we take a very pragmatic approach. So we look at the entire population and we make a determination. We take that information on those individuals and we bang that up against our clinical rule set in our analytics engine to make a determination, where do we intervene? And we create these curated care pathways. And we look at things, everything from whether it's diet and exercise and behavioral change to lower cost anti-obesity medications, and then GLP-1 medications where clinically indicated.
How are you finding that GLP-1 spend is impacting health plans and employers?
They're clearly getting a lot of attention over the course of the past 18 to 24 months, specifically for obesity. And most individuals are looking at it through a first line of defense. And what Vida Health does very well is we make a determination where it makes sense to prescribe those medications. There are medications that have been around with similar impact and effect for decades at a much lower cost. So we make a determination, as I mentioned, how we can actually do that effectively for those particular cohorts within your community as an employer or plan.
We're speaking in the fourth quarter of 2025. So as we look to 2026, where do you see GLP-1 spending and how will Vida adapt with that?
Well, it's extraordinary. The current spend is somewhere projected to be $100 billion spend for GLP-1 medications. Most of those medications are targeted at a specific set of diseases. What we're finding is the indications are actually expanding really rapidly. Most recently, you hear things about fatty liver disease or MASH, sleep apnea, mental health disorders. So it's starting to get more prevalent across the marketplace and where it could adapt some of those medications.
Now, when it comes to health equity, what is the biggest opportunity that you find can make a difference?
Sadly, race and ethnicity has a very big impact on a higher prevalence for obesity. So being able to get access to those individuals through virtual care platforms such as Vida Health really has a big impact on being able to make a difference.
How do virtual care platforms like Vida help expand access to care?
So one of the benefits of having a virtual care platform is you can provide access to individuals in urban areas or in rural areas at a much lower cost to be able to penetrate a marketplace that historically has had a lower opportunity or accessibility to affordable options.
And what are you hoping to take away from this year's Health Innovation Conference?
You know, it's a great place to meet up with old friends, innovative thinkers, watch kind of the trends, and it's exciting opportunity within healthcare and digital health in particular over the course of the next 12 to 24 months. So exciting.
Joe Murad, President and CEO of Vida Health, thank you so much for sitting down with me here at the Venetian.
Appreciate it. Thank you.